we can balance the brain chemistry, balance the hormones, and with through lifestyle and nutrition and nutraceuticals, we can stabilize these levels and get people feeling well.
Today's guest is Dr. Sarah Doyle, a renowned physical therapist and functional medicine practitioner. We'll dive into perimenopause, discussing how to identify its signs, who it affects, and the best approaches to manage it. You'll learn about the latest testing methods, natural remedies, and lifestyle changes to achieve a healthier, balanced life. Hey, good afternoon, Dr. Sarah. Thank you for taking the time to join me today on the podcast.
Hi, Joe. Great to be here.
Yeah, it's specifically, I wanted to dive into this topic of perimenopause. I didn't know much about it. And when I started talking to friends and family, they weren't very aware of it. So if we could start like in a nutshell, like what is perimenopause for people listening?
Sure. So we all know menopause is when well, maybe we don't know. Menopause is when the ovaries retire and women stop ovulating or producing an egg every month for fertilization. Perimenopause is the transitional time where we're going from being, childbearing, ready to transitioning into that menopause time. It's like a second puberty. And it really doesn't get the attention it deserves. Women really need to take care of their bodies during this time. And I'm so happy to be here today to spread awareness. Like if you have a girlfriend, you have a sister, you have an aunt, it's so important to take care of your body during this time to set you up for health into your like 60s and 70s. Like what you do now is going to affect your risk of cardiovascular disease, breast cancer, and all kinds of stuff that we just don't want. We want to thrive at the end of our life. We don't want to be in and out of hospitals, depending on our family members to help us. What we do now in perimenopause is critical. So this is the time when like your periods are getting shorter, you may skip a period, hormones start fluctuating, symptoms like weight gain, insomnia, that's a real big one, and thinning hair, all these things that are just awful, and women don't need to suffer like that. We can get a head start and change it early so you don't have to have these symptoms. Like it doesn't have to be bad.
Yeah, no. And speaking of symptoms, I was curious, like, how does one know if they're in perimenopause?
Well, clinically, if you go to your doctor and you run a hormone panel, or you can do a hormone panel, you can order from a functional doctor, you can get testing done at home. And you want to look for, namely, your progesterone levels start to drop. That's usually the first thing that happens. And that's why women start having anxiety, difficulty sleeping. Progesterone is a calming hormone. Progesterone acts on the brain and the GABA receptors. So when progesterone starts to decline, you're waking up early, you're waking up at 4 a.m., and not able to go back to sleep. You may find that you get anxiety about things that never used to bother you. Those are like some early warning signs that we need to address what's going on hormonally and try to fix it.
Is there like a specific age that people should start being, cognizant of like, hey, let's start paying attention to these signs? Is there a certain age range that people should know that's when you're potentially in perimenopause?
I want to say definitely by age 40, start paying attention. By your mid 40s, you're definitely feeling it. One of the things that women tell me is like, whenever I used to put on a couple pounds, I just like, ate salads for a week, or I stopped eating cookies and it went away. And like now it's not happening. And I don't know, like it's just like what's going on. They start to feel like their body's betraying them. And so that typically happens in the 40s. But, with all the toxins in our environment, all the microplastics, all the heavy metals, it takes a toll on the body. And I'm seeing it even in like the late 30s with some women.
Wow. And when you say like microplastics and toxins, and are there certain tips or recommendations you have for people that say, okay, how to reduce these things in our everyday life that you sort of counsel with your own clients?
Sure. Actually, we take a look. I have two of my books up there. The first one is the Thin Formula, and that's lifestyle modifications. It stands for thyroid, hormones, intercourse, and nutrition. Okay. So I wrote both my books before Chat GPT came out. So like I actually like really wrote them. It's a really quick read, and it just tells us like where are these toxins in our environment? How can we pull them out? Like one of the biggest things for women are like the scented candles. Like everybody loves those romantic smelly candles, but they're full of endocrine disruptors. So, sometimes we can pull some of these toxins out and our symptoms will get a little bit better. So, cleaning up your environment and not drinking out of plastic water bottles, get stainless steel or glass, trying to decrease your pesticide exposure. Look for labels that say non GMO. Look for labels that say like USDA organic because those pesticides are also endocrine disruptors and neurotoxins. So just, you have to spend a little bit more money, but can you really put a price on your health? Like,
Yeah, but when you said like endocrine disruptors, right? Like a lot of people understand, okay, endocrinology, I've heard that term, but what exactly, could you break down like what an endocrine disruptor is?
sure. So your primary care provider might have a hard time helping you with this because endocrinology is one of the hardest disciplines in medicine. A lot of endocrinologists specialize in diabetes and they don't have the knowledge they need to work with like the way the thyroid interacts with cortisol, interacts with blood sugar, interacts with estrogen. So endocrinology can be really complex. Most people have no idea what it means. It's like one of the hardest subjects in medical school. So give yourself a break if you don't understand, and try to find yourself a functional medicine practitioner who specializes in this.
Right. Yeah, because you do read a lot with people saying, studies show how many microplastics you carry in your body and all these, like you said, pesticides, toxins that we're exposed to. And even in younger people, you start to see, wait a minute, these young girls are putting perfumes on or skincare products that are also doing the same sort of disruption that even at that age, you start to see, okay, why are we not paying more attention to these things that are out there and make the choices now for, like I said, tomorrow, 10 years from now kind of thing? How about like when someone knows the difference between perimenopause and menopause? Because you did say, it could be to the mid 40s when menopause starts. I'd like to get into, but how do you know the difference between the perimenopause and the menopause?
The technical definition of menopause is when a woman has not had a menstrual cycle for 12 consecutive months. So they say, if you go 11 months and 15 days and then you have a period, technically you have to start that all over again, the clock. But you get the gist of it. I mean, perimenopause, you may skip 2 or 3 months of a period. Women might think like, oh my God, am I pregnant? And sometimes that's what happens. I don't know if you know anybody whose, parents were like 50 when they, gave birth, but sometimes that happens. Women are like, oh, I haven't had a period in 6 months. I can't get pregnant. And then all of a sudden, whoa, surprise. But yeah, generally that's it. You may go 6 or 7 months without a period, and then it comes back for 2 or 3 months. And technically, menopause isn't until you've got a full year.
Got it. So that's sort of the difference between the two. So you mentioned pregnancy though. So I'm assuming if you can get pregnant in perimenopause, or is there any
Yeah,
sort
you
of
can. It's really hard.
yeah. Yeah, I was going to
It's
ask
really,
like what sort of like, one, can you, and then two, if you can, what are some steps people can take that might be struggling?
oh gosh, IVF clinics are popping up left and right, and even people in their 30s are struggling with fertility. I would say if you didn't meet that special someone until you're in your 40s, get your butt to a fertility clinic ASAP because you don't know. The egg quality goes down, the risk of autism goes up. The longer we live, the more our genes get trashed. You know what I mean? We just don't repair. When we're a little kid, we cut our knee and it's all better in a few days. Now I'm in my 40s, I fall down playing tennis and I've got a scab for like 2 weeks. You know what I mean?
Yeah.
So the older you get, the more you really gotta clean up your diet, and the husband does too, the partner. Like it's almost like you gotta really clean up for like 6 months. And we really want to address methylation. That's kind of a hot topic, the MTHFR, the COMT. Both the male and the female need to address methylation. The male needs to make sure he's taking enough zinc. There's protocols for both partners, but if I would definitely think about a good 6 months of like pre-conception nutrition optimization, and I would definitely see a fertility specialist. Don't try to do it on your own, because if you wait 2-3 years, you might lose your window.
Mm. Well, could you speak a bit to methylation? Like you said, that is a hot topic now, and people have heard the term, I'm sure, to a degree, but most people probably wouldn't be able to explain exactly what it means and how, it affects your body and what you can do. Like you said, zinc and depending on supplements and things like that.
Sure. Methylation is just a fancy word for metabolism. How does your body metabolize certain things, or how does it not? So, for every enzyme that your body produces, there is a gene. And for every gene, there's an opportunity for it to be imperfect. So it could be functioning at 30% capacity. If you have a homozygous SNP, it's called a single nucleotide polymorphism. The gene could be functioning at a 70% capacity if it just has a heterozygous SNP, the single nucleotide polymorphism. So there's more than one methylation gene. There's MTR, MTRR, MTHFR, COMT, the AHCY. We like to look at the vitamin D one, the VOR. The more genes you have that have little SNPs on them, it's kind of a cumulative effect. So, like for example, the MTRR, if both the mother and the father have SNPs on it, the risk of Down syndrome is exponential. So you want to really hone in on, I mean, you might want to get, I guess we should get some genetic testing if you're going to do the IVF, and just look at how handicapped your body is. I mean, nobody has perfect genes. We all have a little bit of this, a little bit of that. And then when you look at the mother and father together and say, well, holy cow, both of us are functioning at a 30% capacity, like we better like really load up on some strong supplements that are high quality, and like, it's the new pregame, right?
Yeah. Yeah. And for people who like are maybe in this situation, supplements, I guess, where are you sort of sourcing these? Are there things that you trust? Are there brands that you feel, you sort of you put your sort of trust behind?
Absolutely. I use Designs for Health products because they've been around for over 35 years. They have a couple farms in the US, and they have a wide range of supplements where I can work with hormones, I can work with detoxing, I can work with brain chemistry. That's like a real passion of mine, is I test brain chemistry. And then they have some good methylation supplements too that will help. Because if you have SNPs on these methylation genes, they affect your cardiovascular health. They may be contributing to anxiety. They affect the way your body will break down toxic estrogens in your liver. They affect the way your body processes serotonin, dopamine, norepinephrine, epinephrine in your brain. So that's why when I have people come into my coaching program, we start with nutrition. We start with the book, The 7X Method, more on that later. And then we take tests. We test methylation status. We test cortisol. I want to see the diurnal pattern. Like, do you have a strong burst in the morning? Do you not? Are you having your burst at night? Is that what's causing your insomnia? So we look at the 5 cortisol readings to see what's going on. We look at all the sex hormones, estrogen, progesterone, testosterone, DHEA, DHT, the downstream metabolites of estrogen, so I can see some flags for inflammation, or possibly, can be some of the estrogen metabolites can be potentially carcinogenic. So if I have a woman where like breast cancer or ovarian cancer runs in their family, or a man with prostate cancer in their family, and I see these metabolites, I say, whoa, something's going on with your liver. You're not able to break things down. How can we support this using therapeutic levels and nutraceuticals? So we do that. We look at brain chemistry. We do a urine test of the serotonin, dopamine, norepinephrine, glycine, GABA. We do 10 different analytes there. And then I also do a combination urine and finger prick test for thyroid, thyroid antibodies, and heavy metals, because low thyroid will also is a huge contributor to miscarriages. So we look at all these metabolites, and then I primarily work with Designs for Health. Sometimes I work with Standard Process. They've been around for like 95 years. I trust these two companies. I know that what they say is on the label is like actually in it. And I've published case studies where we test before and after, and we see that their levels are moving into a mid range to where, they feel good. So that's always great. And then when we test it, it's like, wow, these are actually like really changing their bodies. It's fantastic.
Yeah, no, and you mentioned a little bit though about miscarriage. I wanted to ask you about that. Someone that's in perimenopause, like you said, they could be in their 30s, they could be in that early mid 40s range. Is the risk for miscarriage, does it go up if they're in perimenopause?
Yeah. Technically, any pregnancy after 35 is called a geriatric pregnancy.
Right. Yeah. So you're going to be in that range. So that's where people like yourself, the testing that people can do to sort of, okay, let's figure out these supplements or other, treatments that we can sort of put together to sort of make the chances a lot better that you won't miscarry.
Yeah, we want to optimize everything.
Right. And are there any tests that people do at home for perimenopause, or is this all done typically at clinics?
Oh, everything I do is at home. I started my online coaching business in 2020 because people still had healthcare needs, but everything was closed. And I found that a lot of these tests many times are more accurate. You can't go to a clinic and test your brain chemistry. I'm assuming that's because, Pfizer doesn't want you to know that you can take vitamins instead of Prozac. That's one of the things I do help people get off of, like psychotropic drugs, because some of the side effects, like long-term use of an SSRI, will contribute to your progesterone metabolism for a woman. So if a woman's trying to get pregnant and she's having some hormone issues, she, may want to seek an alternative to the SSRI.
Would you mind just breaking down what SSRI is for people who may not know?
Yeah, sorry. It's like, okay, so like Prozac, that's like the classic one I think of. SSRI is a selective serotonin reuptake inhibitor. So when people have depression, most primary care doctors, their first line of defense is, give them an SSRI. Well, if that doesn't work, then we'll try an SNRI, serotonin and norepinephrine. I think selective norepinephrine. Yeah. So there's all different kinds of drug classes that work on different brain chemicals. But what we can do a whole episode on this. I think it's a crime that, psychologists, psychiatrists, medical doctors, they prescribe these psychotropic drugs without ever testing their brain chemicals. For example, I get patients all the time, like their dopamine levels are sky high, but they have ADD symptoms, and they're given, their regular doctor would have given them Adderall, which would have given them more dopamine. Or they have depression and anxiety symptoms. A normal doctor would have given them the SSRI to boost the serotonin in their brain, but they actually have really high serotonin and it's not metabolizing into melatonin. So, like, it's a crime that doctors don't check this, especially as women. One of the side effects of having the fluctuating hormone levels in perimenopause and menopause is that the brain doesn't like this instability. And we have a lot of estrogen receptors in our brain, men and women. And when you're having these fluctuating hormones, it affects your brain chemistry. And so women know this, like, and they go to a doctor and they just slap on whatever prescription drug, take some Xanax, they're not getting to the root cause. If we can balance the brain chemistry, balance the hormones, and through lifestyle and nutrition and nutraceuticals, we can stabilize these levels and get people feeling well without the side effects of, you take these antidepressants. The hallmark thing is, like, you don't want to have sex, you can't have an orgasm. That's horrible for a marriage. But what's worse, wanting to kill yourself or not having sex? I don't know. They're both pretty terrible. They're not great options.
No, not at all. I'm sure it's definitely not easy for people to kind of make that decision. So obviously, having an alternative is very beneficial. Is there anything though that people can maybe a woman can mistake for perimenopause?
Well, like insulin resistance, I guess that's a big one in this country. Insulin resistance is like the pre-diabetic, blood sugar dysregulation. There's a lot of obesity. So having unstable blood sugar will also cause, it's called amenorrhea or lack of period. It could be that her ovaries are okay and it's just blood sugar. Or if the blood sugar gets too out of control, then another condition called polycystic ovarian syndrome could be taking place. And that's actually one of the number one causes of infertility. That's a metabolic issue. So the blood sugar gets so uncontrolled that the body starts making like testosterone and DHEA, these androgens, instead of making estrogens to, so it's pretty wild. And it's not everybody with PCOS is overweight. You can have thin people too. It's that can definitely be confusing for some women.
So body type does play somewhat into what how this gets diagnosed.
There are some hallmark signs of insulin resistance, like darkening skin here and like the folds, like in the armpits, the elbows, the back of the neck. You can see that's blood sugar dysregulation, sometimes some stretch marks come up along with the weight gain. Not everybody who gains weight ends up with diabetes. You just, you have to test.
Yeah, of course, of course. How about like, is there a duration of time that this perimenopause can last? Is it, a certain number of years?
Uh, yeah, it's about a decade.
Mm.
It can be, or maybe a woman only feels symptoms for 2, 3 years, and that'll depend on her nutrition too.
So can proper nutrition and optimal nutrition shorten that time?
It can alleviate the symptoms. So body fat, it has an, especially abdominal fat, and it's just true for males too. It has an enzyme called aromatase, and the aromatase will convert testosterone into estrogen. So if you have a lot of estrogens in your body, that's going to make things more uncomfortable. When a woman is pregnant, she gets bigger because of estrogen. Estrogen promotes growth. So when a woman has uncontrolled estrogens, she's overweight, her testosterone's converting to estrogen. When it's out of control, you start getting like little cysts everywhere, cysts in her breast. You can get little nodules on your thyroid. The estrogen, the uncontrolled estrogens promote growth. And then we have all the estrogenic pollute, the toxins that I mentioned earlier, like the plastics are estrogenic, the pesticides are estrogenic. Like there's a lot. So, you can have an overweight person who, is churning out more and more estrogen, or you can have a normal weight person who just has poor methylation genetics with the COMT gene, and then they are struggling to detox. And then there's different phases of liver detox. It's really complex, but with all the testing and a proper history intake, we can figure it out and, turn things around for a woman who's uncomfortable in like 3 to 4. It takes women like 3 to 4 months to really make a complete change.
Would you say that there's a certain population that's affected or a number of women? Because like I started this out, like talking to friends and family, a lot of them didn't even know that this existed. So I wonder like what the sort of population affected each year in the U.S. might be.
Oh, I don't know. That's a statistic I have to ask Google. Like how many women are in perimenopause?
Yeah, there's a
No, but
couple million.
yeah, it's a good question. What I do know that it's important to take care of your body during this time, because once a woman gets into menopause, her hormones drop, and estrogen protects both men and women from cardiovascular disease. Estrogen protects the endothelial lining, so of the vessels. So like the inside of your blood vessels, the little tiny ones that are most susceptible to damage, those are protected by estrogens. And, even if a woman keeps the same diet, exercises, everything that she did in her 30s and 40s, like into her 50s, just because the estrogen is dropping, she will experience increased triglycerides. She'll have more visceral fat. So that's why I try to hit women in perimenopause and certainly like in their early 50s. I try to capture this window so that we can decrease the risk of cardiovascular disease. Like nobody dies of a heart attack overnight. Nobody dies of cancer overnight. These diseases take like a decade or two to build. But what you do in this critical time frame when you're going through your second puberty will affect, and you'll have, if you don't take care of yourself now, like it's almost irreversible when you get into your late 60s if you haven't done it right. It's so much easier. Like what they say, an ounce of prevention is worth a pound of cure. It's so
Hmm.
much easier if we can reach women in their perimenopausal years or early menopause to really make a difference at their end of life.
Right, right, exactly. Could you break down like what your services are and what exactly you do, how people can learn more or find you online?
Yeah, absolutely. You can go to my website. It's drsarahdoyle.com, DRSARAHDOYLE.com. There are 4 opportunities on the homepage to click and book a discovery call with me. It'll be a $99, 30-minute Zoom where we deep dive in your health. I can help you either make referrals to different doctors, or we can put you into one of my other programs. So I have a 10-week biohacking boot camp that gets the best results. It is very comprehensive. So, like I said, it's a boot camp. We meet, we have masterminds, we have one on ones, you have an app with a masterclass course library. You get all the testing, you get discounts on the supplements, and then you have 24/7 access to me. And then it's kind of a community. We have a whole WhatsApp group chat for everybody that they actually requested. They wanted me to put them in a group chat so they could stay in touch with each other outside of the masterminds. So it's very supportive and it has the best success, right? That's where we're testing the thyroid, the heavy metals, the hormones, the methylation, the brain chemistry. And then, so that's a really, really comprehensive program. If that's, not needed, we have another opportunity where they can just do like some testing and then do consultations, like on more of like a membership model.
Are you connecting people, like, say, they might live, Idaho or something like that, right? Are you connecting them? Like, do they go and get their labs done at any?
No, nothing. Everything's done at home.
Got
So
it.
the whole thing is end to end. You can do it from your cell phone.
Mm,
Yeah, that's attainable. I try to think of, well, I didn't like the way I had problems, and my gynecologists were clueless. They were clueless. And so that's how I started in this niche. I mean, when I got certified in functional medicine, it was largely because I came from hospitals and I spent a year working in oncology and just saw how like food was killing people. And so I wanted to learn more about nutrition. That's how I got into functional medicine. And I didn't know what my niche was going to be, but my niche found me because, like you said, nobody knows what perimenopause is. Doctors are actually, they get very little education. Whether you're going to an MD, even if you go to a gynecologist or who delivers babies, they have very little education on managing menopause. And women spend like 30% of their life. And so, it's people like me and other, my competition that were, trying to help these women because there's nothing standardized. You can't find what I do in conventional medicine because they're not doing it, because they're not educated on it. They don't know how to help you. They don't. I've been there. I fixed myself. I had thyroid problems. I had estrogen problems. I have cancer in my family. I have all these things. And I worked on myself, I worked on my friends, and that's how the business grew. And so I see people in all states in the continental US. The masterminds are really powerful because I get to teach them. It's almost like I'm not a psychiatrist, but it's like a cognitive behavioral therapy approach. So where you're building the habits, you're getting the reinforcement, you're learning together. It's powerful.
yeah, getting the community, I think, is really important for people because some people, like, again, they may think, oh, I don't know anyone with this problem. I have no idea who to talk to. I have no idea who to ask questions from. But having that community out there and access to someone like yourself obviously makes things a lot smoother for the people that are going through this. So, that sounds like a really good program you have.
Yeah, I mean, they tell me like, they've been going down rabbit holes. By the time they get to me, they have brain fog. They've been trying to fix it themselves. They think they're doing everything right because they're trying to get all their information from Instagram and TikTok because their regular doctor doesn't know. And so you you can't just like piece together 10-second or 30-second reels and think you're going to take care of your health that way. Like, I'm a licensed board certified clinician, and I've been there, and I've developed this program that works every time. Like, my patients don't fail because I figured it out. I figured out what medicine is missing, how we can help these women. If you're sitting at a table with 10 women, 2 of them are going to die of a heart attack or stroke. 1 out of 8 of them is going to have breast cancer. Like, it doesn't have to be that way. We can stop it. We can reduce the risk. We can give a better quality of life.
Yeah, extend the life, better quality, preventative, many things that people can do. They just have to take that initiative and get started today for what, again, 5, 10, 20 years from now is they're going to benefit from.
Yeah, exactly.
Yeah. So listen, I really appreciate you joining me today. Would love to, like you said, talk to you again about another topic, but this has been amazing. And obviously we'll make sure that, all of your links are in the show description for anyone that wants to reach out to you. And again, thank you for your time today, Dr. Sarah.
Oh, it's my pleasure, Joe. Take care.